Thank you. Jamie, are we ready? Is Jamie around here? I was looking for Jamie. Are we ready? We're all ready. Thank you for recognizing Trudy's multiple decades of fighting for choice in Washington State. I appreciate that.
We're a team.
We're a team. Yesterday's radical and un-American decision by the Supreme Court cut off a woman's right of choice in over half of the United States. Let's be clear what this was. It was a decision by Republican-appointed justices as a result of a court stacking strategy by the Republicans in the U.S. Senate, advancing a long-term effort of the Republican Party to strip American women of this constitutional right. And while choice today is protecting the state of Washington, women are more in peril from losing this right in our state than any time in the last 6 decades. Former Vice President yesterday said that we must not rest and relent until abortion is banned in every state in the land, including Washington State. We know Washington State has a long record of standing up for a woman's right of choice. We voted on it. We have supported contraception. We have supported access to reproductive care, and we have supported abortion rights of women. But Mike Pence and the Republican Party have a plan to take away this right from Washington women, and we intend to stop them. And we intend to stop them right here. The right to this choice, this constitutional choice for the last 5 decades, should not depend on which party is in control of our state legislature. But in fact, that is the situation because of this unwarranted decision by the U.S. Supreme Court. We have to understand that in the past 6 years, Republicans have introduced 40 bills to take away and inhibit a woman's right of choice. This building, the steps of which you're standing on in this Capitol, is under assault by the Republican Party. And we need to make sure this November they are not allowed to succeed in that assault. That's our job. We have to understand, because of this Republican assault on women's rights in this state, without a constitutional amendment to solidify this right under our state's constitution, we are one Republican majority of losing the right of choice in the state of Washington. Accordingly, I will be asking the legislators to pass a constitutional amendment under our state's constitution to protect women in our state. Now, unfortunately, instead of being forthright about this, Republican leaders have tried to hide for their own dangerous positions in this regard. Senate Leader John Braun said that the better pathway is to support women who choose to give birth. Well, we should not have government-imposed mandatory pregnancy in the state of Washington. And his approach, his use of the word choose is certainly ironic. Representatives Maycomer and Stokesbury said, well, people shouldn't vote on this issue. We're so harmless. What would we ever do wrong? It's wrong when they make an attempt to take away the right of choice from Washington women. And we need to speak loudly in this regard. So they don't want this to be an election issue. That's great. The easiest way for this not to be an election issue is for them to join us and support a constitutional amendment to our Constitution. Now, I will tell you this, they are embarrassed about their own position. They are trying to hide their own position. But on this issue, they can run, but they cannot hide. Because Washington citizens understand how this is important in every corner of the state of Washington. So, we will have a constitutional amendment. And I can't guarantee that it'll pass, But if we elect enough people who believe in the right of choice, it will, and that's what we're calling for here in the U.S. Capitol. But we have to understand that other states will assaulting their citizens, and by some extension, ours as well. That is why we have to stand strong, and we will make Washington State a sanctuary state for the right of choice here in the state of Washington for other citizens as well. We will use every resource under the law to defend the rights to choice, to defend privacy rights, and defend safety of citizens, including those who come from other states. Now, to do that, to start that effort, next week I will be issuing an executive order to the Washington State Patrol not to cooperate in investigations of other states that would violate the Roe v. Wade decision. In order to achieve a similar binding policy for other law enforcement agencies, we will need legislation. And I will be asking state legislators to give us legislation to make sure that's the standing rule for all law enforcement agencies in the state of Washington. And I'm hopeful that we will pass it. Now, we also know that with other states, including Idaho, taking away this right from their own citizens, there will be more demand on Washington providers. And we will take all steps necessary to make sure those services are provided to other American women who seek this service in Washington State. We know there will be financial needs in that regard. We'll be talking about more in forthcoming weeks as this clarifies, but I will be making $1 million a down payment, if you will, that I have authority as governor right now to make sure these services are provided. So that's what we will start with. I do want to note that this is not a new thing in Washington State. Our great legislators in the Democratic majority last year provided $7.4 million to increase access to provisions, so we've already bucked up these service providers. But we will stand ready, willing, and able to do more as the weeks progress. And we are going to be cautious and not allow unnecessary hospital mergers that would reduce access in the state of Washington. Now, access to data and privacy is very important in this fight. So we are going to be very alert to plug any gaps in our privacy laws so that no one can expose the private information from a Washington citizen or a citizen of a different state who comes here for services. We are not going to allow that data to get back to Texas or Missouri or Idaho. Now, unfortunately, we have to face a reality. This is not the end of this effort to protect the values of Washington State. It is the beginning of an assault on the values of Washington State. We believe that you ought to be able to love who you want to love in Washington State. And the decision and the words of the Supreme Court justices have made it clear that that's next on the plate in the Supreme Court. We believe you ought to have access to contraceptive services in our state, and that's next on the plate of these justices. This is what you get when you vote for Republicans. You get efforts to take away contraceptive services from people in the state of Washington. That won't do. So we're going to fight and continue this fight. But we are united. We are advancing the cause. We have great legislators who are Democrats to fight with us, and I will look forward to you helping us out, electing people who will protect the right of choice in the state of Washington. I'm confident of that. Now I'd like to yield to Representative Lynn Tai, who has been such a champion in so many efforts from Newcastle and Bellevue, who I know is going to fight not to let the people in the state in Bellevue and Newcastle have this right taken away. Come on up, Rep.
Good morning. I'm going to take just a second to really connect with you. I am Milin Thai, State Representative, and honored to be here. I want to thank you, Governor Inslee, for your commitment to protect the people's right to reproductive health. I also want to take a moment to acknowledge our collective pain and suffer that SCOTUS decision yesterday has inflicted upon you and your loved ones.
Yes, thank you. Thank you.
A decision one made that affects their liberty and happiness is nuanced, is complicated and difficult. And that is why that individual is the only one who can make that decision for themselves. Years ago, when I was about to graduate from University of Washington Pharmacy School, I learned I was pregnant despite using contraception. I made a decision to get an abortion. I made a choice that would afford me to finish my education, a choice that would impact my future, a choice that would allow me to have a healthy family when I am ready, a choice that my children are fully supported.
Yes.
Sorry, I'm breathing, because this is hard on all of us.
We're with you. We love you. Yes. Thanks for your honesty.
SCOTUS decision yesterday exposes pregnant people to arbitrary state-based restriction, regulation, and bans that will leave many people unable to access the needed medical care. These restrictions are not based on science nor medicine, and worse yet, allowing unrelated third party to make decisions that rightfully and ethically should be made only by individuals and their healthcare providers.
Yes.
Abortion is safe. It is an essential part of a comprehensive health care, just like any other safe and effective medical intervention. It must be available equitably to people no matter their race, their socioeconomic status, sexual orientation, or where they reside. The impact of this irresponsible decision will fall disproportionately on people who already face barriers accessing healthcare, including people of color, those living in rural areas, and those without ample financial resources. This decision confirms that this is a dark and dangerous time for the people and healthcare providers in America. Here in Washington, I commit to work with my fellow lawmakers, leaders across Washington state, and working with the governor's office to create the strongest possible safety net for the people in Washington and to protect the right of all individuals to their reproductive health. Here in Washington, the people, not politicians, not a judge, get to make the most private and personal decision to your well-being. And that is my commitment. Now it is my pleasure to introduce another colleague of mine, Representative Jessica Bateman.
Turn the mic up for you just a bit. Nice job. There you go. Nice job. Thank you.
Thank you, Representative Tai, and thank you for your courage telling your story. Hi, everyone. Hold on. Too loud.
Trying to make it loud.
You did.
If you just get really next to this mic.
Okay. Can everyone hear me? Okay. I'm honored to be here today. Okay. I'm honored to be here today with my fellow legislators and the governor's office to ensure that in Washington, reproductive health care, including access to safe and legal abortion, remains a fundamental and protected right. I am here today not only as a legislator, but as one of the 1 in 4 women who have had an abortion. That is a healthcare decision that I made privately with my healthcare provider, and I am fortunate that I was able to have a safe and legal abortion in Washington state. That is not something that I've shared publicly, and I would have preferred to have kept that private. But at this dire time in our nation's history, I will not remain silent while this fundamental right is stripped from millions of my fellow Americans. Despite almost 50 years of legal precedent and years of Supreme Court justice nominees stating on the record that Roe is settled law, this activist Supreme Court has issued a decision overturning Roe v. Wade. This is a radical, dangerous opinion that will harm women and people who can become pregnant. It also puts in jeopardy other constitutional protections like the right to privacy, same-sex marriage, and access to contraception. This decision is a direct attack on our bodily autonomy, reproductive freedom, and economic justice. We know abortion will not stop. It will not go away, but safe and legal abortion will. While this decision will impact millions of Americans, it will disproportionately impact people of color, LGBTQ individuals, and those with limited incomes. I know my fellow Washingtonians are outraged by this decision and fearful of what a post-Roe world looks like. Washington voters have continually reaffirmed their support for choice by passing an initiative in 1991 protecting this right. And since then, Democratic lawmakers have consistently strengthened those reproductive freedoms in our state. In Washington, safe abortion will remain legal. And we welcome those coming to our state to seek access to their reproductive freedom. In the coming weeks, my colleagues and I will be working to plan our legislative strategy so we can strengthen reproductive health care in Washington and protect access to safe and legal abortion, including added protections for medical providers, shielding them and patients from other states' penalties for abortion, increasing patient privacy protections, enshrining the right to abortion in our Constitution, and increasing reproductive health care access across our state, because you can't access reproductive health care if you don't have it. My colleagues and I are committed to protecting the right to choose for all, and we need you, each and every single one of you that's impacted by this decision, to remain vigilant, to organize, and to let your voices be heard, both here and in our nation's capital. Thank you. And now I would like to introduce my fellow reproductive health care champion, Senator Dhingra.
My name's Manka Dhingra, State Senator from the 45th Legislative District and Chair of our Law and Justice Committee. It is absolutely surreal for me to stand here today in the year 2022 and talk about the ramifications of Roe being overturned, not as an academic discussion, but as reality. The fact is that my daughter has fewer rights in this country than my mother had. But in Washington, abortion, reproductive health care, gender-affirming care are legal and available. However, these rights have to be fought for and protected year after year. While we have the laws on the books, our laws are only as good as the access they create. They're only good if we have providers who can deliver these services. Washington has to ensure that all Washingtonians, regardless of where they live, can access comprehensive reproductive health care without needing to drive for hours. Washington has to ensure that all hospitals, regardless of whether or not they are faith-based, provide timely and necessary medical treatment to all. We will be working on this issue so it is ready for next session. It is critical for our state to ensure that those seeking medical services are protected from civil and criminal prosecution, and that those providing these much-needed services are also protected from civil and criminal liability. We need doctors who are trained on how to perform abortions. We need doctors who can go to work without being harassed or threatened. And we need to ensure that there are comprehensive health clinics that are easily accessible to all those who need them. We need data privacy protection for medical records, as well as for electronic surveillance of individuals. We updated our cyber stalking and cyber harassment statutes last session, and we'll be looking at doxing for how to protect individuals from the public release of their personal information. So while abortion, reproductive health care, gender-affirming care are all legal in Washington, there is a lot more work that needs to be done to ensure that they're accessible to everyone in Washington and all those individuals who need to leave their home states to access medical care. Because that is the world we live in now, that our state has to be a sanctuary state for other Americans who simply need to access medical care. And this is a decision that needs to empower every single person to make sure that they're going out, registering to vote, and making sure they are voting for individuals who are reproductive health champions. Because otherwise, all our rights are under attack. And now it is my privilege to introduce one such champion who has been working on this issue prior to being a senator for our great state. Someone who is the majority whip of the Washington State Senate, Senator Emily Randall.
Hello. My name is Emily Randall, and I'm the senator for the 26th district. I'm also a daughter, a sister, an auntie, a queer Chicana woman, and a former Planned Parenthood fundraiser. I'm here today in this place, but also in office in the first place, because we knew this day would come. This war on abortion access and our reproductive rights to keep us from planning our families when and how it is right for us has long been waging. Right-wing extremists have been vying for power and control over our bodies, but we will not let them win. Women and LGBTQ folks, people of color and allies have long been fighting back, resisting and reclaiming our power. Midwives like my great-grandmother in rural New Mexico in the 30s, activists, including many of you, who passed Washington's ballot measures to codify abortion rights in the 70s and the 90s, and the activists across the state who got out the vote to take control of the Washington State Senate in 2017. Because of you, we passed reproductive parity, requiring insurance companies that cover maternity care to also cover abortion access. Because you organized and voted, together we passed reproductive health access for all, guaranteeing access to abortion and reproductive health care regardless of gender identification or immigration status, because you organized and voted. We passed comprehensive sex ed because you organized and voted. We extended the Reproductive Parity Act to cover college student health plans because you organized and you voted. We protected pregnant patients, ensuring that folks experiencing miscarriage or ectopic pregnancy cannot be denied life-saving care at Catholic hospitals because you organized and you voted. And this year, we passed the Affirm Washington Abortion Access Act, updating our statute to be gender inclusive, strengthening our network of abortion providers, and protecting providers, helpful friends, and Lyft drivers from the type of vigilante lawsuits we're seeing in Idaho, in Texas, and across the country. And we did it because you organized and you voted. We have worked tirelessly to strengthen and protect reproductive health access and abortion access in this Washington. But just because our right to abortion is codified in state law does not mean we can stop fighting. Because 5 years ago, anti-abortion extremists in the Republican Party controlled the Washington State Senate, and we will not let them win it back. We will organize, we will vote, and we will not stop fighting for our reproductive rights and our freedoms. Thank you. And no one fights harder than our organizers at Planned Parenthood Alliance Advocates, and I'd like to welcome Courtney Normand.
Thank you, Senator Randall. My name is Courtney Normand. I'm Washington State Director at Planned Parenthood Alliance Advocates. And it's truly an honor and a privilege to be here in solidarity and partnership with you all. Today, I and all of my colleagues at Planned Parenthood are holding our patients in our hearts. Working for reproductive health rights and justice is not just a job, it is our calling and it is our deep passion. I want to recognize our entire clinical services team, our area services directors, health center managers, clinicians, medical receptionists, and all clinical and education staff for being the heart and hands of our mission. I want to also recognize our Patient Access Center for fielding phone calls, not only from patients who are afraid and seeking answers in any of our 6 states, including Indiana, Kentucky, Idaho, Alaska, and Hawaii. They also field calls from people who want to see us fail. Thank you for being there for our patients no matter what, and for caring for all of our patients during this awful time. I'd like to share some important information and a message of reassurance for our patients. In Washington State, thanks to decades of relentless work to defend and expand our rights by leaders like those behind me and by leaders like all of you, across our state, abortion is still legal today with this majority. All Planned Parenthood health centers in Washington are and will remain open and operating We are here for you no matter what, with supportive doctors, nurses, and expert staff who will continue to provide the care and resources you've come to rely on. If you're pregnant and seeking an abortion, Planned Parenthood's Patient Navigator team is here, ready to help you, to find an appointment and provide you with the information and resources that you need to access care. To get in touch with those patient navigators or to learn more about your options, please call 1-800-230-7526. Go to PlannedParenthood.org or abortionfinder.org or just walk in to any of our health centers in our state. It's important to be aware of fake health clinics, also known as crisis pregnancy centers. Have you heard of them? Yep. They may advertise pregnancy counseling, but they don't provide abortion. They won't give you factual information about your options. They will lie. And there's no law requiring them to protect your private medical data because they're not healthcare providers. They're not subject to HIPAA. All of the providers on abortionfinder.org are real. As state abortion bans and restrictions sweep the country, we understand this is an emotional, scary, and confusing time. We will keep providing updates as the situation unfolds, and know this: Planned Parenthood is here for you today and every day. We believe your body is your own. You deserve the right to control your own body, life, and future. We will continue to provide quality, essential health care and education, and we will never stop fighting for your right to access the health care you need. Make no mistake. Make no mistake, this decision goes beyond abortion, as you've heard. The wrongful ruling is about who has power over you, who has the authority to make decisions for you, and who can control how your future is going to be. Our rights are not safe just because we're in Washington. They're safe because we fight, we organize, and we have the right leaders here. For now. The court has especially failed Black, Latinx, Indigenous, and other people of color, people with low incomes, people in rural areas, people with disabilities, immigrants, and more who are disproportionately harmed by abortion bans before yesterday and onward due to this country's legacy of racism and systemic oppression. Exactly. But our movement was built for this. Generations before us have fought tirelessly to gain and protect our rights. Now it's our turn to pick up the mantle. We are powerful. We will rebuild. We will love one another. We will tell each other our stories. And we will reclaim the freedom that is ours. We will never stop fighting to restore and defend the rights of all people seeking sexual and reproductive health care, and we invite you to join with us. Thank you, and it's now my pleasure to introduce my dear friend and colleague, Dr. Erin Berry. She's Washington State Medical Director for Planned Parenthood Great Northwest, Alaska, Indiana, and Kentucky, and Hawaii. And she's also Director of Clinical Research. Thank you so much.
Hello, everyone. Thank you, Courtney. Thank you, legislators, and thank you, Governor Inslee, for your relentless work to increase abortion access in Washington State. As Courtney said, my name is Dr. Erin Berry. I'm an OBGYN physician and proudly provide abortion care in Washington and Idaho. I currently serve as the Washington Medical Director for our local affiliate. I won't go through all the states like Courtney just did because it's a long list. I want to talk today about the importance of abortion and to share a physician's perspective for why Governor Inslee's work today to expand access is so critical. First, I want to emphasize that abortion is fundamentally an act of love. My patients get abortions for all kinds of reasons, but at the core, each of those reasons is rooted in love. Love of self, love of family, love of community, love for humanity. Second, abortion is common and essential healthcare and safe. Like many things in life, pregnancy can be complicated. Each person's medical history, circumstances, and journey is unique. As their doctor, I took an oath to provide high-quality, evidence-based education to help people make the best decisions for their own health and life. Abortion bans try to impose a false black or white world and cruelly ignore the complexity not only of real-life healthcare decisions, but also the complexity of our lives as humans. Being able to provide abortion can not only make the difference of whether my patient lives or dies, but can change the course of their life. We know that denying or turning people away requesting abortion negatively impacts their physical health, their mental health, and their long-term economic security. Let's be clear, abortion bans will disproportionately impact those already facing horrific healthcare disparities, such as adolescents, those living in rural areas, and especially communities of color. As a direct result of racism, Black women and birthing people already face horrifically high rates of maternal mortality and morbidity in this country. Therefore, courts and legislators legislating abortion and banning abortion, the medically safest option in some cases, is dangerous and cruel and will set back our nation's effort to improve maternal health. My heart breaks for my patients, for my future patients, but also for my colleagues in other states who will now be forced to not provide life-saving care, forced to follow laws that break their oaths as physicians and harm their patients. As we enter a post-Roe world, I am incredibly grateful to be in Washington State, where our governor, legislators, and people understand the importance of abortion as essential health care. But I also worry about what the future will hold. Yesterday's decision shows us that access to abortion is in no way certain and is not a guarantee. We need to continue pushing in this nation and in Washington State to increase access and to enshrine abortion rights into our legal system. The work Governor Inslee and the legislators in Washington are doing here today, what they are describing today, will do just that and will start this fight. Thank you. And with that, I'll turn it back to Governor Inslee for questions.
Thank you. Thank you. Thank you. I wanted to note we've got a lot of leaders here, including the speakers, who I really appreciate. Also, Senator Cleveland here, Senator Frock, Representative Stonier, and I think I see Senator Sam Hunt there. He's the surfer dude in favor of choice, which we appreciate. I want to address this issue of, we've talked about the clear and present danger to the right of choice that one party in our state represents. And I wish we didn't have to think in these terms. I wish the pro-choice position was a bipartisan position that we could work across the aisle to protect. There was a time when we did that, when Ronald Reagan Republicans supported pro-choice laws in California, when Joel Pritchard, my predecessor in the 1st Congressional District, helped pass the initiative, the first in the United States, to create a pro-choice state. Those days, sadly, are gone. The Republican Party today is under the control of a radical renegade group that will stop at nothing to destroy this right. And that's why we need to get active this November. That's the fundamental situation. And when I say active, I mean active. There's a lot of angry people today. We saw them in the streets last night. This is an extremely angering event. But I do believe it is our obligation to channel that anger into action. And I can tell you, personal commitment can make a difference. I know a woman once who got active in Yakima in 1988. She decided to elect a pro-choice candidate in Yakima, Washington in 1988, and Trudy got her husband elected. And now And now I think it's a good thing we got a pro-choice governor of the state of Washington, too. I think that's a good thing. But we got to understand, I'm not going to be around forever. Let's pass a constitutional amendment to protect the women of the state of Washington. With that, we're happy to stand your questions. You can direct your questions to anyone you'd like, or the whole panel. We'll start to reporters, please. We'll start over here.
Whoever wants to take this, one of the measures talked about was protecting data privacy for patients. What specific types of additional measures can be added to do that?
I'm going to offer one idea, and I think our legislators will have more. Basically, we need to extend an obligation. The question, thank you very much. The question is, what can we do to protect data? Number one, we can make sure there will be enforcement of our existing laws, that we will have teeth in our existing laws. Number two, the obligation to protect that data needs to extend to those who have it in their databases, not just the provider. So, and three, provide investigatory mechanisms to enforce our existing laws, to our state patrol, to our local law enforcement. Any other thoughts you'd like to offer? Anyone else? Monica?
I'll just say we also have to take a look at the subpoena power that will come when other states want this info. We have to take a look at the subpoena power that we will have to take care of when other states want data and information on individuals who are accessing medical care. So there's a lot of work to be done in order to make sure we're protecting that data of care that is provided for the individuals, also taking a look at the providers who are providing that care. And we also have to take a look also of electronic surveillance. There's a lot of information that our phones have on where we are, how long we're there, and that information also needs to be protected.
One thing that does not require our action is for you to reach out to people you know in other states and tell them to delete their menstrual cycle apps on their phones.
Yes.
Thanks, Monica.
Are there any plans to, given the fact that there will likely be a surge of people coming to Washington for abortions, are there any ways or plans in the short term and the long term to increase funding for abortions and for those who might come and not have funds to pay for it?
Yes. First off, I noted that I will be making the question. Thank you. The question is, are there any plans to help provide services to out-of-state residents? Yes, starting with $1 million that I will use under my emergency authority to help providers have access to make sure those services are available. I'm sure there will be more needed, and I will be working with legislators to make those resources, financial resources, are available. We also need to increase the people who have the ability to provide these services. That's why we've been very committed to increasing the nursing staff and physicians. Legislators have been great extending additional nursing capability. Let me address why this is the right thing for Washington to do for our fellow Americans. When the COVID epidemic hit, in the state of Idaho, Republican politicians refused to protect their citizens. They got a lot more COVID cases than we did on a per capita basis. We did not shun our protection. We admitted their patients to our hospitals. That was the right thing to do with our neighbors. Similarly, when Republican politicians ignore the needs of Idaho women, we're going to take care of them. That's the right thing for Washingtonians. The question was about the alliance with California and Oregon that Governors Newsom, Brown, and myself announced yesterday. We're going to do everything we can to magnify each individual state's effectiveness in this effort. We want them to know there's a wall in the West Coast protecting the women of the West Coast and the citizens that come from these other states. And so So we will try to make sure our laws work in tandem effectively. We will make sure that if somebody tries to sneak around our law in one state, we advise our colleagues of a way to defeat that. And I'm glad we have this alliance on the West Coast. In Ronald Reagan, the pro-choice Republican, the last one, is protected. Questions? Anybody? Yes?
Can we truly handle an increase of people coming from out of state? They're saying maybe 400%.
Well, that's why we are going to have additional financial resources to hire more medical personnel, to achieve any of the physical things we need, any of the equipment things we need, any of the training things we need. There will be a need for additional resources, and they need to be ramped up. Planned Parenthood, other providers have been planning to do this. I'm relatively confident we will succeed in making sure these services are available.
Can you talk about the companies that have stepped up to say, hey, we're going to help pay for transportation of patients out of state of Washington?
All the good companies have stepped up to the plate for transportation. Would anyone like to add anything else? Anything? Yes.
Just to your first question about are we ready for this influx of patients, our Planned Parenthood Federation President Alexis McGill-Johnson yesterday was saying we're asking 24 states to take the patient load of 50. That's real. Unfortunately, we've been preparing. We've known this moment was coming. We could see this coming. We have been preparing. I think it will have a ripple effect on the healthcare network, though. We're going to never turn someone away. We are going to take every patient we can. We're going to make more spots in our schedules for abortion care. And so that also means looking at new solutions for family planning and cancer screenings and sexually transmitted disease treatment and testing. Those kinds of services we'll be able to innovate with telemedicine. But yes, we have a provider shortage, and we're really grateful to hear about these investments in training and more access, especially in rural areas.
Thanks, Courtney. And I'll just say that we are ready for this. We've been planning for decades. We've been planning for decades for this potential reality, and it is here. It's not going to be easy, but we are here and we are planning. What I will say, we're expanding. We're training advanced practice clinicians to perform procedural abortion, and we're increasing access to telemedication abortion and teleabortion for contraception and STI screening as well. So we are doing many things, and we will continue to learn on how to do things more efficiently and more effectively.
I'd like to note these legislators were far-sighted because they appropriated $7.5 million in the last budget to try to get ready for this anticipated wave as well. Other questions? Any other questions? From the press? From the press. Are there any press questions? Okay, we're just going to have press questions today. Thank you so much. Let's continue the effort on behalf of freedom and liberty in the state of Washington. Take care. Thank you very much. Good luck. I'm glad you were so stalwart. Thank you very much.